Let's talk about something I know you're not very comfortable talking about with your sister, with your mother, with even your boyfriend or your husband. Because anytime somebody talks about something like this, it just feels like a very dirty thing. Hi, I'm Dr. Joyce. Welcome to our day 3 of Beginner's Guide to Womanhood. I'll be talking about vaginal discharge. I'm very sure you're trying to run away from this conversation, but if you can't handle it, that's fine. Just simply scroll away. And if you can't handle it, then I suggest you stay put to listen to the rest of the things I'm about to say. First thing first, vaginal discharge can be normal. For instance, you take off your pants at a particular time of the month and you notice a particular discharge on your panties. And this particular discharge is whitish. It's really stretchy. I'm going to put a picture up. It's really stretchy. That can indicate that you are in your ovulation period and you are actually ovulating. And that is absolutely normal. Where we start to have an issue with discharge is when you notice that you take off your panties and you notice like a greenish yellowish discharge that smells, that has a weird smell, and also it has some other things like itching. You tend to pee a lot when you notice this kind of discharge. That is when you start to notice, okay, this one is no longer normal. The next discharge I'm talking about is the creamy discharge that you sometimes see on your panties, which sometimes don't even have a smell, or sometimes it smells like milk, and it can even reoccur most times at different points of the year. And this is as a result of your body telling you that you are upsetting the vaginal's pH. Maybe you're using a soap that is too harsh for the vagina, or you are douching, you're just doing something wrong up there, and your body is trying to tell you that this is what is happening, and that can be a yeast infection. So when you notice all of this kind of abnormal discharge, aside from ovulation discharge, it's only reasonable that you speak to your doctor and you get yourself tested and treated appropriately, and not just inserting boric acid up your vagina, but actually treating a particular infection causing that kind of discharge. So some discharge can be normal and some can be abnormal. So you don't see a discharge all the time on your panties and start to swallow all the pills of the world, okay? If you find this video reasonable, share it to your friends. Do not hoard information, okay? We don't do that here. All right, bye for now.